What is the most important, the most foundational thing you can do to get started with movement in the postpartum period? I'm going to show you today. Hi, everyone. I'm Dr. Sarah, family physician, wife, mom of 5, and exercise enthusiast. So this is literally breathing. This is the most important thing you can learn, that you can practice. It is the foundation on which you build all other things. This is critical postpartum. It is also hugely important really for anyone that maybe is lacking core strength, that really needs to work on reconnecting to their body. We're gonna just do this standing today. You can do it in all different positions, but you can do it anywhere, anytime. Literally, it's amazing. So I take my hands in a C shape. I wrap them around my ribs. I do a huge, really big inhale. And then exhale audibly. You're gonna keep practicing that. I'm gonna give you some tips. So on the inhale, you feel those hands expand open. Your ribs expand forwards, sideways, and backwards. That's why it's called 360. So it's the ribs expanding in all directions. On the exhale, it's audible, like you're blowing out hundreds of birthday candles. As you're doing that audible exhalation, your hands are contracting back down as your ribs contract back down. Simultaneously, you also are feeling your deep core ab muscles tighten around you like a corset, or like as if you were being like wrapped up in mummy tape, or like a corset. It just, instead of a sucking in feeling, it's more of that tightening around. So let's do another one. Big inhale in. Exhale. I talked about a lot of stuff. I'm going to say it again. On the inhale, ribs expand forward, sides, and back. On the exhale, ribs contract down, hands are coming back down in. Exhale everything out that you can. The ab muscles are tightening across your belly like a corset, or as if you're being wrapped in mummy tape. Okay, another one. Inhale. Exhale. Last thing is to think about your pelvic floor. So on the inhale, your pelvic floor relaxes down. On the exhale, it contracts up and in. If you imagine a tissue on the floor, the contraction is like you're picking that tissue up with all 4 corners of your pelvic floor. So it's inhale, pelvic floor relaxes, exhale, pelvic floor up and in as the ribs contract. Amazing. Watch this video again. It takes a lot of practice. It takes a lot of reps. Trust me, I know, I've been there, but you can do it. Follow for more. Bye, everyone.